Hello, I'm Dr. Pamela Ruegg, and I hold the David J. Ellis Chair in Large Animal Clinical Sciences and Antimicrobial Resistance at Michigan State University. And as part of our series on antibiotic usage on dairy farms, I'm going to be discussing today prevention of antibiotic residues in both meat and milk. I can't overemphasize the importance of this topic because we need to ensure that consumers have confidence that we're producing milk and dairy beef that's wholesome and free of residues. Fortunately, there's lots of systems in place to ensure that that happens. The FDA rules require that both milk and meat are screened for the presence of drug residues. When milk or tissues from dairy beef are found to have violative residues, that milk or that meat is discarded. There's a fine, an actual considerable fine to the producer, and importantly, corrective actions are put in place. So there's a whole system in place to ensure that milk and meat is safe and free of residues. There's really no mystery about this system. Reports about residue detection are publicly available on the internet. And you can look at the National Milk Drug Residue Database and over the decades, look at the trends in the amount of violative residues that have been detected. Now, producing residue-free milk is the law. And to ensure that, that milk is free of residues, several different samples of milk are routinely tested for antibiotic residues. The most important sample is probably the bulk milk. All of the milk that leaves the farm is screened for the presence of violative residues of the most commonly used antibiotics before it's processed into the products that we consume. In addition, individual milk samples are collected on farms and they're randomly tested to ensure that those samples are free of residues. And then finally, the FDA also goes into the marketplace and purchases dairy products and tests them for the presence of antibiotic residues. And the good news is, over the last 20 years, actually over the last 35 years, the number of positive samples has consistently declined. And that tells us that producers and veterinarians are getting better and better at using antibiotics appropriately. In the graph that I've got up there on the screen right now, you'll see the percent of screened milk samples that were positive for beta-lactam residues. Now remember, this milk was all discarded. It was detected and discarded. And what you can see is just the steep decline over the last 20 years in the number of samples that had violative antibiotic residues found. You'll also notice that in 2022, we're getting pretty darn close to zero. And that shows the importance of this topic to the industry. Now, in addition to screening milk for antibiotic residues, the USDA Food Safety Inspection Service also looks for residues in dairy beef. When dairy cattle are sent to be slaughtered for beef, inspectors take samples from selected animals and they test them for the presence of antibiotic residues. And this data is also publicly available. What I'm showing in this slide is a comparison of the number of inspector-generated residue violations in cull dairy cows in 2011 and then 10 years later in 2022. And really the most important point is they've declined dramatically. And so you can see that the industry is doing a better and better job of ensuring that we're maintaining and producing the type of products that consumers are looking for. So that's the testing end of the program. Let's talk a little bit about why antibiotic residues do occur, even though they're rare, and how we can prevent it. Well, antibiotic residues in milk or meat basically occur because people manage animals and people make mistakes. And the type of mistakes that contribute to antibiotic residues are mistakes in recording treatments, mistakes in identification of treated animals, mistakes in communication, or mistakes in appropriate training of the people who give the antibiotics. Interestingly enough, if you look at that last slide about the antibiotic residue violations in meat, you'll notice that most of the residues that were detected were from drugs that up until June of this year, 2023, were available for over-the-counter purchase in the US, meaning you didn't require a veterinary prescription. But as of June 2023, all antibiotics given to food-producing animals in the US will require veterinary prescriptions. And that brings us to an important point. One of the best ways to reduce the risks of residues in milk or meat is to ensure that the local veterinarian is involved in animal health decisions. So a strong relationship between the producer, the farm worker, and the local vet. And like most things that local vets and veterinarians do on farms, the emphasis should be on reducing the need for antibiotics by preventing disease. So that's our emphasis. But when animals get sick, there's a number of things we can do to reduce the risk that a treated animal will inadvertently contribute milk or meat to our food system. And one of the things we should do is the veterinarian and the treatment team on the farm, the workers on the farm that give the treatments, need to agree upon treatment protocols. Written treatment protocols should be in place, and they should routinely be reviewed and updated as conditions change or personnel change on the farm. Ideally, those treatment protocols follow the product labels, and therefore the withholding period for the milk or meat can follow that product label. However, when a local veterinarian recommends that for the good of the animal an extra label treatment is given, it's very important that the producers follow the withholding period that the veterinarian prescribes, because extra label usage is only legal when it's done under veterinary prescription. Now, we've got some of these errors that occur, and there's some things we can do to reduce the risk of having antibiotic residues. First of all, one of the things we can do is limit the number of people who are allowed to give treatments. Only highly trained workers, and few of them on any farm, should be allowed to administer antibiotics. That will limit the risk of making errors. Second thing, to reduce the risk of recording errors, we need to make sure that every animal on the farm has a permanent and visible ID. And when an antibiotic treatment is given, there's two records that should be kept. There should be a cow side record, which is the writing down of that treatment as the treatment's administered, and that information needs to be transferred to the permanent record as soon as possible. And then finally, we want to reduce the risk of communication errors. And there's a couple things we can do to effectively do that. One thing I've seen on a number of farms that's highly effective in reducing the risk of shipping a treated cow for meat is to require signatures from two separate people before an animal is allowed to leave the farm and be slaughtered for meat. And of course, for milk, we can test the milk from treated cows and from purchased cows before it's put in a bulk tank. All right, let's just recap. Most farms use some antibiotics to treat some cows, but there's a lot of safety guards in place and to prevent antibiotic residues from getting in milk and meat. However, residues rarely occur, but they do occur sometimes because people make mistakes. So there's some simple practices that we've reviewed which we can use to reduce the chance of errors. Now, there's some good news. Every year we're getting better at this. Fewer and fewer violative residues have been detected every year over many decades. And the number one thing we can do to ensure that that trend continues is to ensure that the local veterinarian is engaged in working with the local farm to prevent disease and to ensure that treatment protocols are effective.